Math from Town, Pharmacist by Tran. Who are pharmacists? Pharmacists read prescriptions from doctors. The prescriptions tell them what medicine the patients need, and they fill the prescription. Pharmacists must know what all the medicines each patient is taking. Some drugs cannot be taken at the same time. The pharmacist explains to people how to take their medicine. They also tell people the side effects they might have from the medicine. Types of pharmacists. Community pharmacists work in retail stores or drugstores like Walgreens and CVS. Research pharmacists work in labs and make new medicines and tests to be sure the new drugs work. Clinical pharmacists work in hospitals, clinics, nursing homes, or other healthcare facilities. They help doctors find the best medicines for their patients. They may also work with patients and advice on how to take the medicines. A pharmacist's education. To become a pharmacist, you need at least spend 2 to 4 years in college, 4 years in pharmacy school. Upon graduation, you will get a doctorate degree called PharmD. Fun fact, there are 8 pharmacy schools in Texas. Types of math pharmacists use: addition, subtraction, multiplication, division, conversions, fractions, measuring percentages, and measurements. Why is math important to pharmacists? Pharmacists must accurately measure and package medicine, ensuring that its dosage is safely administered to a patient. It is important that pharmacists get calculations correctly, because if the math calculation is incorrect, the patient can underdose or overdose and can get sick. Pharmacists must accurately measure and package medicines because a single error can prove harmful. Pharmacists use the math to calculate dose and dosage. A dose is an amount of medicine that is taken, such as 1 teaspoon of cough medicine. A dosage is the size or frequency of a dose of a medicine, such as 1 teaspoon 3 times a day for 3 days. Example: Tylenol, the dosage information will be based by age and weight for children. Pharmacists often are required to convert a dosage strength or drug quantity to an entirely different unit of measurement when filling a prescription. Here I have some examples of common conversion. I have an example that a pharmacist would encounter on a daily basis while working. A prescription was written for medication that is 500 milligrams per tablet and to be taken 2 times a day for 10 days. How many tablets should be dispensed for a 10-day supply? How many milligrams does each dose contain? 500 milligrams per tablet. What is the dosage per day? 500 milligrams times 2 times a day equals 1,000 milligrams per day. How many of the tablets are needed for the patient? 1,000 milligrams divided by 500 milligrams per tablet equals 2 tablets. 2 tablets times 10 days equals 20 tablets for 10 days supply. I have another example of math that a pharmacist would encounter on a daily basis. A patient was advised to take 300 milligrams of medicine 3 times a day for 5 days. Each tablet contains 300 milligrams. How many milligrams are needed daily? Well, 300 milligrams times 3 doses a day equals 900 milligrams a day. How many tablets are needed for the treatment? 900 milligrams a day divided by 300 milligrams a tablet equals 3 tablets a day. 3 tablets a day times 5 days equals 15 tablets total. I have another example of math that a pharmacist would encounter on a daily basis. A patient brings in a prescription for cough syrup. The direction says, take 1 teaspoon once a day for 5 days only. Dispense quantity as a doctor ordered. How many milliliters of cough syrup is needed? Conversion. 1 teaspoon equals 5 milliliters. Math. 5 millimeters times 5 days equals 25 milliliters total for 5 days. Joke of the day. What did the doctor say to the sick pig? I think you should see a pharmacist. Interview questions and answers. Name the person being interviewed. Juan T. Occupation, pharmacist. Date and time of view, March 3rd. Question. What do you do during a typical day? Answer. I verify prescriptions to make sure it's accurate for the right patient, right dose, and the right drug. Question. What services do you provide? Answer. I dispense prescriptions ordered by doctors. Question. How do you use math on your job? Answer. I use math to figure out the right dose and to build the insurance properly. Question. How has the way a pharmacist uses math changed over time? Answer. Math has changed mostly by technology. We rely on calculation from computers and use prescription processing programs. Question. What math tools does a pharmacist use now that were not used in the past? Answer. Calculators and computers. This is a chart of types of math that a pharmacist uses on a daily job. Read and write numbers. Compare and/or order numbers. Convert between fractions, decimals, and percents. Use factors and/or multiples. Round to estimate. Use reasonableness of answers. Check for accuracy. Use formulas. Use ratios / proportional relationships. Use rates. For my product, I did a Jeopardy about pharmacy. I have a QR code and a link to get to the Jeopardy. These are the Jeopardy questions in case you couldn't scan or put in the link. These are the answers in case you didn't have the link or you couldn't scan the QR code. Works cited.